patient suffers a DHS with a territorial conflict that entails a smegma track. For example, a man has smelled his rival's smegma when catching his partner red-handed. His AIDS test will be positive. Circumcised men, for example Muslims or Jews, cannot test positive as long as the contact is restricted to circumcised men who do not produce smegma. AIDS is not a disease. It is merely a harmless allergy test, which has intentionally and falsely been labeled a disease. Since viruses that supposedly cause AIDS, SARS, pneumonia, the avian flu, bird flu, swine flu, hepatitis, herpes, measles, polio, cervical cancer, and the like cannot be found in the human body, orthodox medicine uses a rather unscientific method. Namely to conclude from the rise of antibodies produced by the alleged immune system, the presence of the virus and hence an infectious disease. This method is called indirect evidence. In the developing world, tuberculosis is now considered a disease related to AIDS. A territorial fear can be shared by people of large regions, for example, during a natural disaster, during war times, or through scares of terrorist attacks or pandemic fear-mongering, AIDS, SARS, swine flu, and the like, by the media. Pneumonia is also the most common lung condition associated with HIV and AIDS. As we now come to understand, there is no causal relation at all to the alleged virus, but rather to a territorial fear or scare-fright conflict associated with the disease, AIDS-acquired immune deficiency syndrome. If there is evidence that HIV causes AIDS, there should be scientific documents which either singly or collectively demonstrate that fact, at least with a high probability. There is no such document. Dr. Kary Mullis, Nobel Prize Laureate for Chemistry 1993. Up to today, there is no single scientifically convincing evidence for the existence of HIV. Not even one such retrovirus has been insulated and purified by the methods of classical virology. Dr. Heinz Ludwig Sanger, Emeritus Professor for Molecular Biology and Virology, Max Planck Institute for Biochemistry, Munich. In 1983, the American researcher Robert Gallo claimed that he had discovered the human immunodeficiency virus, HIV, as the agent responsible for the cause of AIDS. In 1984, Gallo published 4 articles in Science, in which he stated that he had isolated the HIV virus. In December 2008, 37 legal, medical, and research professionals sent a letter to the journal, asking it to officially retract the original 4 papers that made the case for HIV as the cause of AIDS. According to the authors, widespread evidence had emerged that Gallo's studies were not only poorly carried out, but that their results were falsified. The letter from the 37 experts includes a letter from Gallo himself, admitting to another researcher that HIV could not be isolated from human samples alone. In addition, a letter from an electron microscopy expert revealed that there was no HIV virus contained in Gallo's 1984 samples. Dr. Palmer, the AIDS symptoms are the result of the invention of AIDS. Based on the understanding of the 5 biological laws, most of the AIDS symptoms are caused by the diagnosis shock and of biological conflicts triggered by the fear of the disease. Here are a few examples. Death fright conflict involving the lungs, lung tuberculosis, lung emphysema. Scare fright conflicts resulting in respiratory symptoms such as bronchitis or pneumonia. Frontal fear conflicts, non-Hodgkin's lymphoma. Abandonment and existence conflicts, kidney cancer. Self-devaluation conflicts, anemia, leukemia, bone cancer, lymphoma. Attack or feeling soiled, conflicts, shingle, Kaposi, sarcoma. Territorial anger conflicts, hepatitis. Separation conflicts, skin rashes, herpes. Bleeding conflicts triggered by blood tests, leading to an enlarged spleen. Note, usually, a rise in antibodies is considered a sign of a strong immune system, but not when it comes to AIDS. In HIV tests, the presence of antibodies is considered an indication that the person is seropositive. In other words, infected with the human immunodeficiency virus. A spleen enlargement is typically seen in people with leukemia or with AIDS who have to undergo blood tests or blood transfusions on a regular basis. What is termed Kaposi sarcoma, KS, are tumors that show as purple or brown blotches. They present the typical picture of melanomas. Yet, in conventional medicine, the growths are nowadays considered an AIDS-defining illness. See also shingles. AIDS-related Kaposi sarcoma arises in people who are infected with HIV. It was in part the unusual and sudden appearance of this form of TUS in so many young men at the start of the AIDS epidemic that led doctors to realize that a new disease had emerged. Is homosexuality a health risk? Based on the knowledge of GNM, the rise of the new disease was caused by the fear associated with HIV and AIDS, feeling soiled or infected by a person who is HIV positive, or feeling attacked because of one's sexual orientation, rather than by a virus that has never been proven to exist. Like Kaposi sarcoma, in conventional medicine shingles is construed as a disease related to AIDS. In the days before the HIV/AIDS pandemic, shingles used to be seen only in older people or in those who had weakened immune systems. Nowadays, shingles are very common with HIV infections and AIDS. Health 24, 2012. Since the early 1990s, German biologist Dr. Stefan Lanka has been at the forefront of challenging the medical theory stating that viruses are the cause of infectious diseases such as hepatitis, AIDS, the flu, polio, herpes, or measles. Caroline Marcolin has presented Dr. Oward Lanka's activities in her lecture video, Virus Mania, in great details. Watch part 2 of the recordings on this website starting at 0808. Based on his studies in virology, Dr. Lanka discovered that viruses are vital components of simple life forms that do not exist in complex organisms, such as humans, animals, or plants. His research shows that the viruses believed to cause viral infections are, in reality, ordinary cell particles that have been misinterpreted as constituents of the viruses in question. Dr. Lomka also determined that viruses don't have a destructive effect on the host, as commonly believed. These findings are in full accordance with the discoveries of Dr. Gerthammer, who demonstrated already in the 1980s that, contrary to the standard theory, microbes do not harm the organism but play instead a supportive role during the healing process of diseases. See fourth biological law of the new medicine. The participants of this Congress had good intentions and nominated me for the prize of Astoria. I am most grateful for the recognition. But an award, my dear friends and former colleagues, always involves two sides, someone who awards the prize and someone who accepts it. However, the prize of Astoria for medicine comes with a heavy debt. In April of this year, the prize was awarded to Professors Gallo and Montagnier for their discovery of the so-called AIDS virus, which in reality does not exist. The presence of an HIV virus has never been established in AIDS patients. Montagnier himself conceded at a congress in Barcelona 10 years ago that he had never observed the presence of an AIDS virus. Now he is giving the lie to himself and lets himself be awarded. The main argument against AIDS as a disease in itself are the findings of the ontogenetic systems of tumors and the derived ontogenetic system of microbes. Nobody has ever observed typical symptoms after a so-called HIV infection, as are commonly associated with measles and rubella. If a patient tested HIV negative, and if he was taken ill with, for example, cancer, rheumatic fever, sarcoma, pneumonia, diarrhea, tuberculosis, herpes, or any other neurological symptoms or disorders, then these would commonly be regarded as normal diseases according to popular opinion. However, if the same patient tested HIV positive, then all these symptoms would be considered malignant AIDS symptoms, or even AIDS metastases, pointing to the imminent and agonizing death of this poor AIDS patient. It must have something to do with the patient's psyche if someone falls seriously ill only after having been told to be HIV positive. Has no physician ever been able to fathom what goes on in a patient who is brutally confronted with this devastating diagnosis? And is it not quite strange that AIDS, which is thought to be a viral disease, progresses entirely differently from all other viral diseases? Those are commonly considered as overcome in the presence of a positive antibody test result. You must forgive me, but I am a very practical man. It is certainly interesting to enter into a theoretical discussion of AIDS, but in the meantime, those poor people are being terrorized and killed by AIDS, exactly as is the case with cancer. Those who do not wish to publicize the true correlations and contexts of cancerous diseases, and those who have kept me locked up in jail, are the same who masterminded the fatal immunodeficiency disease, AIDS, conveniently driving a second nail after cancer into the coffin of those patients, condemned to death, and ultimately granting the perpetrators even more power. As with HIV, hepatitis, SARS, polio, H5N1, H1N1, HPV has never been isolated and scientifically proven. T. Engelbrecht and C. Cohenline, Virus Mania, 2007. In line with evolutionary reasoning, viruses should, theoretically, assist the reconstructions of organs and tissues deriving from the ectoderm, controlled from the cerebral cortex. Concerning viruses, in GNM, we prefer to speak of hypothetical viruses because the existence of viruses that cause so-called viral infections has never been scientifically substantiated. None of the alleged viruses, HIV et al., has ever been isolated from a host cell, nor has their DNA been properly identified, which are the basic criteria for the proof of the existence of a virus. Details presented in the Virus Mania GNM DVD. Virus Mania by Torsten Engelbrecht and Klaus Kohlmein, 2007. The existence of these so-called killer viruses must first be proven. And this is where the trouble begins. Consequential, scientifically sound evidence has never been provided, even though it's as easy as taking a sample of a patient's blood and isolating one of these viruses in a purified form with its complete genetic material, genome, and virus shell directly from it, and then imaging it with an electron microscope. But these critical initial steps have never been done with H5N1, avian flu, the so-called hepatitis C virus, HIV, and numerous other particles that are officially called viruses and depicted as attack-crazy beasts. 43. Conventional medicine claims that hepatitis is caused by hepatitis viruses. A, B, C, D, E. However, as demonstrated in the publication Virus Mania by Torsten Engelbrecht and Klaus Kohlmein, certainly nobody has yet managed to detect a corresponding virus structure in the blood serum of so-called hepatitis C patients. As with HIV, the virus purification necessary for a clear identification has not taken place. P. 155, 15 study. In short, none of the alleged hepatitis viruses, or any virus has ever been scientifically verified. Details are presented in the Virus Mania GNM DVD. This seriously questions the justification of vaccinating newborns and of imposing immunization on travelers who, naturally, develop hepatitis after having resolved the territorial anger conflict away from the inner environment. Biological conflict with biological conflict linked to the spleen is a bleeding or injury conflict, a self-devaluation conflict associated with blood. In nature, an inability to fight because of a large bleeding wound quickly leads to death. In real terms, the conflict is triggered by bleeding due to an injury, hemorrhaging, or heavy periods, but also when there is blood in the stool, in the urine, or in the vaginal discharge, which often causes great panic. A blood cancer leukemia diagnosis, a positive HIV test, the fear of being HIV positive, being on dialysis, blood transfusions, or distressing blood test results could also evoke a bleeding conflict. Taking blood-thinning medication can keep a bleeding conflict active because of the danger of severe bleeding. Venereal disease are generally assumed to be bacterial or viral infections that spread through sexual contact. Yet, to this day, the existence of disease-causing viruses, herpes simplex virus, herpes zoster virus, HIV, HPV, and the like, has never been scientifically proven. Apart from that, based on the knowledge of the 5 biological laws, venereal diseases such as gonorrhea, chancroid, syphilis, genital herpes as well as candidiasis, C. penile candidiasis or vaginal candidiasis, and cancers involving the sexual organs, C. cervical cancer, cannot be sexually transmitted since the symptoms are already healing symptoms. Hence, a sexual partner can only get, for example, herpes if he/she suffered a separation conflict at the same time, let's say because of imposed sexual abstinence based on the belief that the condition is contagious. The fear of having contracted a sexually transmitted disease could also activate a separation conflict. The distress experienced through unwanted sexual practices or forced prostitution explains why the incidence of venereal diseases is more common among particular groups and populations.